millions of dollars cut. It was all supposed to help mental health patients here in Oklahoma City. KOCO's Bree Steffen joins us now live with more details. Bree?
It was a very emotional day here. Hundreds of people jammed into one room to speak out against millions of dollars worth of cuts against the state's mental health services. Many of the people I spoke with today say the risk of getting rid of these services is just too great. Hundreds filled this room at the Oklahoma Health Care Authority to voice their concerns about a $24 million cut in mental health services. This affects more than 30,000 Oklahomans getting rehabilitation services. And all of this is because of the newly passed budget by state lawmakers.
The state of Oklahoma has lots of issues, and we don't have enough money for mental health, and nobody likes to see things cut. This will make sure that the most vulnerable populations of adults and children are receiving rehab.
The cuts would mean patients like 10-year-old Jermaine would lose guidance services that have helped him overcome self-esteem and self-confidence issues over the last 6 years. With no help from his parents, Jermaine's aunt says the mentoring program has saved him. She's convinced the money should come from somewhere else.
There are funds out there that can support the program, because I mean, if it doesn't start with our children, then the cycle has to be broken at some point.
But many health experts believe this is the best way.
A lot of people are upset about it, and again, it's a tough time for everybody, but I think if we have to find $24 million in the budget, this is the most responsible way to do it.
And the final decision for the cuts is set for June 26th, and if that passes, these could go into effect as early as July 1st. Reporting live in Oklahoma City, Bree Steffen, KOCO 5 News.